Thank you all of you for being here. We can start. The Bermuda triangle and its technique to identify from the uterine organ. The reason why I'm doing this technique is to identify how deep the uterine organ is before we start with the LA. And that way we can decrease the bleeding from the surgery. My name is Carlos Leon from Chihuahua, Mexico. I'm a gynecology oncologist. At the beginning of the surgery, we have to take a quick peek to see the internal organs just to plan our surgery. As soon as we get into the right pelvic side wall, we have the opportunity to see the internal retroperitoneal organs. That's the right ureter. If you can see right there, that's the right ureter. So before we start doing a window right in the retroperitoneal space, we have to see where the internal or retroperitoneal structures, important structures are. I will put a little bit of color over the right ureter after doing the anatomical inspection before we start the opening of the retroperitoneal space. If you find your way hard to find the ureter, you can go to the bifurcation, and that's the color. That's the right ureter. So I'm sure I'm not going to go here. My window will be here. That's why I put this the Bermuda triangle, because it's an inverted triangle over the uterobody ligament, the ureter on the medial portion, and the IP ligament on the lateral portion. If you see this triangle, the best way to do it, your window is right in the middle. Right in the middle, I know that this space is a vascular space, but that doesn't mean that the space is dead. So you will have a little bit of bleeding. I'm trying to find the superior vesical artery, which becomes in a very bright white color, and it's very easy to find. I'm sure, and I know where the ureter is, so I'm sure I'm not going to damage the right ureter. The reason why I call this the Bermuda Triangle is on the Atlantic Ocean. Everybody's scared to cross over the Bermuda Triangle. But once you know that nothing happened, because the evidence to show that planes are disappeared is so poor, once you know the anatomy, nothing happens. That's the superior vesical artery. Now I know that the uterine artery will become in this site right here. That's the uterine artery. That's the bifurcation from the hypogastric artery. I'm gonna put a little bit of color, red color, just to make sure that this is the just to show you the superior vesical artery and the uterine artery. After I identify the uterine artery, I put a couple of titanium clips. You can use the look, whatever you feel comfortable. And I know where my right ureter is. If you know the anatomy, it will be very difficult to have an accident during your surgery. I use the ligaments, but whatever you can use the look, whatever you feel more comfortable. Now we're going to the left side wall. We're making our window. We just finished a paper that shows. We just finished a paper over 100 cases doing this technique, and it shows that 30% of the cases you will find a variation on the hypogastric artery. Anatomical variation. So in this case, I found a little bit of bleeding more than the other side. That's the color of the superior vesical artery, and I can't find the uterine artery. It's correct to step back, irrigate a little bit, find the uterine artery before you can apply the clips. Know that the the left uterine is right here, so I'm just doing a separation. That's the uterine artery and the supravesical artery. Both come from the hypogastric artery. I do a double cleaning. There is no evidence to show that it's better than one, but feels better. And thank you very much for your attention.
Any questions?
Why are you doing 100 cases?
I did 100 cases clipping the uterine arteries for benign conditions. Why? Because I feel that if you cut the bleeding from the uterine artery, my study shows that the recuperation from the patient is better. The bleeding is much minimal. That's that the study shows.
So you're doing myectomy and like that?
No, not myectomy, hysterectomies.
Excellent.